New this morning, Health Secretary Robert F. Kennedy Jr. announced the FDA is removing black box warning labels on various hormone therapy drugs. Right now, CBS News correspondent Shanelle Kaul is joining us live from the newsroom. Shanelle, we want to talk about this. Why did U.S. health officials decide to drop those warnings in the first place?
Well, look, Mugo, good morning to you. So the FDA is now saying that these hormone therapy drugs are essentially safe to use. These are drugs, by the way, that are used to treat symptoms for menopause and perimenopause, and they can have a pretty drastic impact on women that are going through those things. So the FDA is now saying today it's going to be removing the current black box warning labels that are put onto those drugs. Here's more on that from Health and Human Services Secretary Robert F. Kennedy at the press conference this morning.
For the first time in a generation, the FDA is standing with science and standing with women. The era of ignoring women's health is older. The era of patronizing women is older. The FDA will follow this science, and America's women will finally get the care, the respect, and the honesty that they deserve. Today, we are restoring integrity to medicine, restoring faith in public health, and we are restoring balance to the lives of millions of women who have been ignored for too long. And that's what it means to make America healthy again.
So, Mugo, this is significant. It's a really big deal because about 20 years ago, these black box warning labels were put onto drugs like this that were used to treat menopause and perimenopause. And at the time, experts, Mugo, had said that the reason they were doing this was because there was a risk of breast cancer associated with using some of these drugs. Now we've got more updated research, and experts today are saying actually that research back then 20 years ago, they now say is flawed. They say that some of the research was gathered on older women, and actually because some new data has now come up, they say that when they look at this new research, when they look at this new data, what they now see is that these drugs are safe to use if they're used before the age of 60 to treat symptoms of menopause or perimenopause. So this is a significant new update on this. I also want to note that before this announcement today, our Nora O'Donnell exclusively sat down with FDA Commissioner Dr. Marty McCary to speak about this. Here's a clip from that interview.
We go through all those studies, and our team has done a very systematic review, and our scientists at the FDA firmly believe that we should not be putting a black box warning to tell women, hey, there's a risk of breast cancer, a topic that sensitive you have to treat very carefully. No clinical trial has ever shown that it increases the risk of breast cancer mortality.
And so, look, today, these doctors, these researchers are saying that the benefits of these hormone therapy drugs actually outweigh the risks for women that are going through menopause or perimenopause that would use these kinds of drugs to treat some of the symptoms that come up in that process. And so you can watch the extended interview with Dr. McCary as well right here on CBS News 24/7 coming up at 3 p.m. Eastern. Back to you.
All right. Seems like a change many women may have been waiting for. Shanelle Kaul, thank you so much.